Let's go further in depth now, and to do so, I'm so pleased to be joined here by Olga Villaverde, our Newsmax TV contributor, and also by Dr. Raul Perez-Vasquez, who, for being here. Meantime, in the newsroom, it's our friend Newsmax Deputy Health Editor Nick Tate. We thank you all for your time. Nick, you're the journalist. Give us the who, what, why, and where. What is the latest on that patient in Dallas?
Well, the latest reports are that he's not doing very well. In fact, he is in danger. The hope was that he would recover, but because he's not getting this experimental drug, he has not been doing too terribly well, and that is the concern. There are also today, I will tell you, there are meetings in the White House with health officials to look at whether or not we should be doing more to restrict travel to West Africa, whether we should be doing more in terms of entry checking for people coming here to airports in America to check for Ebola, and whether there are more things that we can do in the hospital. So today is going to be a big day in the investigation of this outbreak.
Well, doctor, that Texas hospital is back in the news for releasing this patient even after finding out that he traveled here from Liberia. Who's to blame in this situation?
So many reports have come out on so many different problems throughout the entire chain. However, clearly the first thing, and it's a basic thing that needed to be done, was a travel history in this patient. That was never carried forward to the physicians. It is actually a basic part of the history and physical, travel history for any kind of infectious disease, and should have been taken into account.
Nick, let me bring you back into this discussion, and JD, you know this for a fact. This patient was in contact with about 80 people in Texas, and fears obviously are running rampant. Some parents are even keeping their children at home from schools. Obviously, they're concerned. Do you feel, Nick, this is an overreaction, or are parents doing the right thing?
You know, I think the truth is that for weeks we've been hearing from public health authorities that, in fact, there's nothing to worry about here, that Ebola would be contained and controlled. Yeah, there might be an isolated case here or there, but we have the means to control it. But what happened in Dallas reflects that, in fact, it was not controlled. In fact, mistakes were made at the ER that let the patient back out into the community. So I completely understand people's concerns, and my opinion about it is that we should be at the absolute highest levels alert and looking at very aggressive ways to keep this Ebola virus and outbreak from spreading beyond the danger zone in West Africa.
It is interesting, Nick and Doctor, to hear from the girlfriend of the man who was infected, the Liberian who came here. She has gone before the cameras asking why her dear friend, Mr. Duncan, wasn't getting experimental drugs to help him in his fight with Ebola. Here is what she had to say, courtesy of ABC News.
I want them to know that I am doing just fine in health, but I am worried. I want Eric to be taken care of. The medicine that he gave, the other Americans that came from Africa 2 days ago, that gave him the same medicine. I don't think Americans, they are doing enough to save him.
Well, that's quite a charge. Withholding medicine, Nick, is there anything to that?
Well, what we're hearing from the officials is that there isn't enough of the medicine to give to Mr. Duncan. They've run out of those experimental supplies. You know, as you know, there's no cure, there's no real treatment for Ebola. They only treat symptoms. And so there's been a rush on, a race to try to develop these experimental drugs, but they've only had a limited number of supplies, and only a few people have gotten them. That's what we're hearing from the other side. So I think she may be right that we may not be doing enough, but it's not as if, from what we can tell by the reporting, that drugs are being withheld from this gentleman.
We have another expert to bring in on the discussion. Glenn Cohen, a Harvard law professor specializing in medical ethics. Glenn, we thank you for Skyping in this morning from Harvard. Obviously, Mr. Duncan's girlfriend is upset. Do you believe, and we have about a minute right now, so 30 seconds, please, sir. Do you believe that the medicine is being withheld from this Liberian patient?
Not withheld purposefully. There are limited supplies, and there are protocols in place to decide who gets them when supplies are limited.
Fair enough. We will continue this discussion on what the ethically responsible way to deal with this in terms of public health. We will go on with that. Doctor, we're asking you to stay here, and to our friend at Harvard Law School likewise, and of course Nick Tate in the newsroom. Gentlemen, all of you please remain, and we will be back with more on this story. In the meantime, you may have your own take as you watch this coverage of Ebola. Are we handling it the right way in the United States? Why don't you tweet us your comments at Newsmax TV, #America's Forum. There's also newsmaxtv.com/comment. And don't forget Facebook. Our faces are coming right back after this.